Question number 21. The length of cervix is option A 3.5 centimeter, option B 4.5 centimeter, option C 2.5 centimeter, and option D none of the above. It is about 1 inch, 2.5 centimeter long. Option C. The neck of the uterus or the inferior narrow portions of the uterus called cervix. Question number 22. Cervix develops from option A Fallopian duct, option B mesonephros, option C Mullerian duct, and option D metanephros. Right option is C Mullerian duct. Mullerian duct is one of the bilateral ducts in the embryo that form the uterus, vagina, and fallopian tube. Question number 23. Fallopian tube is lined by option A columnar epithelium, option B stratified epithelium, option C ciliated epithelium, and option D germinal epithelium. Fallopian tube is lined by ciliated epithelium. Option C is right answer. Fallopian tube or uterus tube, यसलाई uterus tube पनि भन्छ अथवा oviduct पनि भन्छ, is the hollow cylindrical that extend from the lateral angle of the fundal end of the uterus and terminate near the ovary. The size of the fallopian tube is 10 centimeter. Inner layer is lined by ciliated columnar epithelium. Cilia helps to propel the sperm toward ovary and fertilized ova toward uterus. Question number 24. The length of the fallopian tube range from option A 22 to 27 centimeter, option B 7 to 12 centimeter, option C 28 to 31 centimeter, and option D 2 to 7 centimeter. The length of the fallopian tube is 7 to 12 centimeter. Option B is right answer. Exact size 10 centimeter हुन्छ. Question number 25. Egg cells are seen in the option A intestine, option B stomach, option C fallopian tubes, and option D vagina. Egg cells are seen in a fallopian tube. Option C is right answer. Egg cells are non-ciliated epithelial cells present in lining of a fallopian tube, 10% of a total cell. It provides nutrition and protection to the ovum and also activate the sperm. Question number 26. Narrow part of the fallopian tube is option A interstitial part, option B isthmus, option C infundibulum, and option D ampulla. The narrowest part of the fallopian tube is interstitial. Option A is right answer. Fallopian tube have 4 parts: interstitials, isthmus, ampulla, and infundibulum. सबभन्दा न्यारो पार्ट हुन्छ interstitial, जसलाई intramural पनि भन्छ. यो चाहिँ 1.25 सेन्टिमिटर को हुन्छ लेन्थमा र डायमिटर 1 mm. isthmus को लेन्थ हुन्छ 2.3 सेन्टिमिटर एन्ड डायमिटर 2 mm. ampulla को लेन्थ हुन्छ 6 सेन्टिमिटर एन्ड यसको डायमिटर 5 mm हुन्छ. यो भनेको चाहिँ सबभन्दा वाइडेस्ट एन्ड लंगेस्ट पार्ट हुन्छ. एन्ड infundibulum को लेन्थ हुन्छ 1.25 एन्ड डायमिटर 5 mm. Question number 27. The longest portions of fallopian tube is option A interstitial portion, option B isthmus, option C infundibular, and option D ampullary. The longest part of the fallopian tube is ampulla. Option D is right answer. Question number 28. The functions of fallopian tube is option A secretion of estrogen and progesterone, option B passageway of fetus, option C occurrence of fertilization, and option D developing fetus. Occurrence of fertilization is the main functions of the fallopian tube. Option C. The other functions of the fallopian tubes are covering the fertilized ovum or zygote, not fetus, from ovary to uterus, and spermatozoa from the uterus toward the ovary. It provides a site for fertilization. Question number 29. Following is the function of fallopian tube. Option A, secretions of the estrogen and progesterone. Option B, helps in a fetus development. Option C, acts as a passageway for the fetus. Option D, mobility of fertilized ovum. The function of the fallopian tube is mobility of fertilized ovum. Option D. Question number 30. X-ray study of fallopian tube is known as. Option A, salpinography. Option B, myelography. Option C, cholecystoscopy. Option D, pyelography. X-ray study of fallopian tube is known as salpinography. Option A is right answer. It is used in testing patency of the tubes in investigating infertility. Question number 31. In which part of the female body zygote develop? Option A, vagina. Option B, fallopian tube. Option C, ovaries. And option D, uterus. The right answer is option B, fallopian tube. Question number 32. Fertilized ovum is implanted into uterus after. Option A, 7 days. Option B, 1 day. Option C, 8 days. And option D, 10 days. Fertilized ovum is implanted into uterus after 7 days. Question number 33. Which statement is not true about ovaries? Option A, the ovaries are 2 in number. Option B, secretion of estrogen is an important function of ovaries. Option C, secretion of testosterone is also an important function of ovaries. Option C, secretion of progesterone is also an important function of ovaries. Secretion of testosterone is also an important function of ovaries. This is not true. So the right answer option C. Next about ovulations and fertilizations, which is in other videos. Thank you so much.